Radiation oncology, otolaryngology, and head and neck surgery from the University of Pittsburgh Medical Center and UPMC Hillman Cancer Center in Pennsylvania. That's in the United States. And I'm really happy to be here today with a number of my colleagues here in Cluj for what is the state-of-the-art radiation machine in not only Cluj, but in Romania. And this is called the TrueBeam STX. And this is a machine by Varian, which allows us to treat tumors anywhere in the body with pinpoint precision, a kinder, gentler kind of radiation, not the radiation of the past. And so I have my colleagues here who I'm going to have introduce themselves, talk a little bit about them, and we'll talk a little bit about this technology that the patients in Cluj and frankly in Romania have access to now that are similar to the technologies that we have in the United States. And in fact, technologies that some centers in the United States doesn't even have. So, Dr. Mihai?
So I'm Marina Mihai. I'm a radiation oncologist trained in Romania first, then in Canada, and I was lucky enough to work for University of Pittsburgh where I learned this technology. I currently work in Ireland, but I am extremely proud to be helping this team from Medisprof, extremely professional, extremely patient-oriented. And I hope that the government allows us, and the politicians, will be able to offer Romanian patients who deserve as much as treatment as well as in Ireland, other countries in Europe, US, we will be able to offer them this high technology, highly curative treatments, which they really should have access to. There is no reason why Romanian patients shouldn't have the best care that it is available.
Close to home. Close to home.
At home.
At home. I agree. So,
Professor Saiful Haq, I'm the Director of Medical Physics at University of Pittsburgh Medical Center. It's actually UPMC Hillman Cancer Center. That's in Pittsburgh, excuse me, and Pittsburgh, Pennsylvania. So I'm a physicist, so I know a little bit about technology. So in the United States, where in Pittsburgh area we have 28, 29 cancer centers, and everywhere we have really the high end of technology. So what you're seeing here is the TrueBeam STX. This is really the high end, Varian's highest end technology that they provide now. They'll call it Edge, they'll call it TrueBeam STX. The gut is the same. The machines are, they all perform very high quality treatment, okay? But one thing to really know, your equipment is as good as the professionals. So you can have the highest end technology, but if you do not have the right professionals,
trained personnel.
Trained professionals, you will not be able to give the best quality of care to the patients. So I've been, I've seen Dr. Carolina and Carolina, of course, and Adrian Udria. So I've known them for some time, and I've seen this center grow, and I've seen what is in their heart. They really want to bring the best quality of care to the patients close to their home. And it's my understanding that patients are going abroad, paying from their own pocket to get the best care. I mean, if I had cancer, I wouldn't want to be treated here because I know the capabilities of the professionals as well as the technology that that is available. That's the dream. What you have here is really the dream of many Western cancer centers.
So again, we wanted to speak directly to the citizens of Cluj and other interested parties to say, we recognize and we deal with this. I, leading our cancer program on the international scene, have gone to many, many countries, and we recognize that in many countries there are waiting lists. In Ireland, for instance, we still have waiting lists. In fact, when we started our cancer center 11 years ago in Ireland, we had waiting lists for, say, head and neck cancers of 6 to 8 weeks. If you started with a stage 1 head and neck cancer, by the time you got to treatment on that waiting list, you had a stage 3 or stage 4 where it was far less likely that we were going to cure you. And so I understand that there's a waiting list here also in Romania, in Cluj, we have a program here that can see you right away and that can treat you and cure you earlier. And so that's the important thing, is for you to know that in fact you have state-of-the-art comprehensive cancer care, not in the country next door, not in the public system, but right here, close to home and available, with a team that is trained in state-of-the-art comprehensive cancer care. And so I'm just really proud of the work that the team here has sort of put together. We're proud, in fact, this would be essentially like our programs in Western Pennsylvania. And so I would be personally happy. I'm not necessarily wanting to have cancer, but if I should have cancer, and all of us know somebody that has cancer, to be treated here at Medisprof with the latest technology, with a kind, caring, compassionate staff. What else can you ask for when you're facing a challenge such as cancer? So come on down, take a look. We'll probably get the website up so that you can see it. And as a professional, as a professor of radiation oncology, knowing all the technology and the challenges and burden of cancer, it's great to know that Romania has the resource, has a place where you can access state-of-the-art comprehensive cancer care.
I just wanted to add one other thing, in terms of the capabilities of this machine. It's my understanding that none of the other centers in Romania can provide some of the capabilities.
It has all the capabilities.
Like this machine can provide. For example, treating patients with gated radiotherapy.
What's gated radiotherapy?
Gated radiotherapy is, so for example, if you have a tumor that moves, okay, and you want to...
What's a tumor that moves? Like a lung cancer?
Lung cancer.
Okay, I'm just asking because
You
a lot of the people out there won't know what a tongue
Good
cancer that
question.
moves.
Good question. You have lung cancer, and you have a tumor inside the lung, and this normally the way we'll treat this lung tumor is we'll radiate a lot of normal lung tissue using radiation, and that's not good.
Cause a lot of side effects,
There's
doesn't
a
it?
lot of side effects. You're giving
Patients
a lot of
are dying of
toxicities.
side effects.
Yeah, a lot of toxicities that come from these. So the capability that the gated radiotherapy that I mentioned is that, as this tumor moves, what you do, the radiation beam is normally shown this way. If this is your radiation beam, like an ice cream cone comes in, and the radiation is coming down this way, and if the tumor is moving like that, so when the tumor comes under the radiation beam, then you turn the radiation beam on. And when the tumor moves out of the radiation beam, you turn the beam off. So all of this is done automatically. And by doing this, what you're really doing is treating just the tumor. And you are avoiding treating a lot of the normal tissue. And you can really give a very high dose of radiation without giving any toxicity to it.
And why is it important to give a high dose of radiation, say, in lung cancer?
Because, from all our studies, different clinical trial studies that we have seen, that you need to really cure that. You need to give a certain
dose, exactly.
Dose of
And
radiation.
it's a balancing act, because to get that right dose in, if you're not careful, you'll get a lot of side effects. And you probably have seen patients who've had radiation therapy with side effects. Well, this technology, this machine, and the staff that runs it in this hospital actually are capable, they're trained to deliver that state-of-the-art care and while reducing the side effects. So with that, guys, I want to thank you very much.
I would have a question for you.
Sure. Yes.
Like, as we discussed previously, in Romania there are large waiting lists.
Mm-hmm.
They are patient, like